Good day, everyone. My name is Anna Marie I Eating BS1C student. So today I'm gonna show you how to do the hygiene in bed bath. So what is hygiene in bed bath? Hygiene is a type of bath given while the client is on bed. The purpose is to make client clean and feel comfortable, to increase sense of well-being, to promote muscular relaxations and relieve feelings of fatigue. The equipments are wash basin, bath blanket, bath towel, washcloth, patient gown, hamper for solid linen, gloves, soap, hygiene supplies, which are the lotion, powder, and deodorant. The last is bed pan. Next is the procedure, which is the assessment. Assess client's tolerance to activity, assess room temperature and ventilation, in order to have information of the client and to have the ability to perform the procedure, and also to give a correct temperature of the patient. Next is the planning, wash hands to provide cross-contamination, and gather all necessary equipment to lessen time and effort. Next is the implementation. Identify the client and explain the procedure. Provide privacy. Offer bedpan or urinal. Adjust bed to a comfortable working height position. Place bath blanket over the client before removing the top sheet. Remove client's gown, ensuring he or she is covered with bath blanket. Place client in semi-fallows position and remove pillow if permissible. Make commit of the washcloth. Wash client's eye from the inner canthus toward the outer canthus. Wash client's face, ears, and neck. Rinse and pat dry. Wash arm far from you, distal to proximal including axilla, using long firm strokes. Rinse and dry. Repeat procedure on the arm near you. Wash client's hand in basin. Rinse and dry. Wash chest and abdomen using long firm stroke. Rinse and dry. Expose one leg at a time and wash leg far from you with long firm strokes. Rinse and pat dry. Repeat procedure on the leg near you. Immerse and wash client's feet and the basin. Rinse and pat dry. Replace water. Turn patient on his or her side and place towel alongside of the back. Wash the back and buttocks with long firm stroke. Rinse and pat dry. Place the client in supine position and cover with bath blanket and then wash the perineal area. Rinse and pat dry. If patient is able, place a towel under the buttocks and bring basin and soap with client's reach. Instruct client to complete the bath him or herself. Have a client wear a new gown and comb hair. Apply lotion if desired by client. Remove equipment, use and store them in proper place. And after that is wash hand. Next is the evaluation. Evaluate the client's comfort to ensure that the procedure is done and the client is satisfied. The last is the documentation. Document the procedure to include type of bath, administer and client's response for have a legal purpose that the procedure is done. Next is the sponge bath. So what is sponge bath? Sponge bath is used of a wash basin filled with cool or tepid water to sponge the client in order to dissipate heat from the body through conduction and vaporization. The purpose is to reduce elevated body temperature and to make the patient comfortable. The materials or equipment are basin, washcloth, towel, bath blanket, and gown. Next is the procedure, which is the assessment. Determine the need of client to provide what the clients need. Next is the planning. Wash hands to prevent the cross-contamination. Assemble equipment needed to lessen time and effort. Next is the implementation. Identify and explain the procedure to the client. Take the client's temperature. Fill basin with water at appropriate temperature of about 25.5 degrees Celsius to 32 degrees Celsius. Sponge the client's face and forehead with plain water. Do not dry. Place cool moist washcloth in axilla and groin. Remove when they start to dry. Reassess client's body temperature and pulse after 30 minutes. Discontinue bath when desired temperature is reached, usually lasting for 20 to 30 minutes. Pat the client dry when bath is completed. Place client in a comfortable position. Put on a clean gown on the patient. Move equipment, use and wash hands. Next is the evaluation. Reassess body temperature to ensure that the temperature is good while doing the procedure. The last is the documentation. Record the type of procedure, rendered body temperature and client's response to have a legal purpose in the near future.